So zinc acts by reducing the absorption of copper. Chelator is getting the copper out of the body through urine, whereas zinc is not absorbing the copper, only what you have ingested through your diet. But zinc acts slowly. So we do not use zinc as a first drug of choice when the patient has been diagnosed with Wilson's. It can be used in neuro Wilson's, the brain Wilson's, but in liver Wilson's, we do not use zinc as the first choice. We use a chelator first, but when you want to put the patient on a maintenance therapy, you can switch over to zinc. So that is how we use copper and zinc. In zinc, we want urine copper, when the zinc is being given, we want urine copper to be between 40 to 100. That's how we monitor patients on zinc. Sometimes we use a combination of both. So patients not tolerating high doses of D-penicillamine, we reduce the dose of D-penicillamine or Trientine and add a zinc. But the important thing is that these drugs have to be taken on an empty stomach. So don't take any food at least 1 hour before or 2 hours after the drug. Patients tend to take both these drugs together. Even if we are giving both these drugs, they are given at different timings. So don't take first Cilamine and then penicillamine and then the zinc. If you are giving both together, then penicillamine in the morning and zinc at night. So they have to be separated out. Both have to be on empty stomach with full 1 glass of water, and that's the way to give these drugs. We also say whenever you're giving penicillamine, take pyridoxine supplements with it because it can cause pyridoxine deficiency. The important thing we need to monitor even in patients who are on D-penicillamine is a 24-hour urine protein in the beginning, because some patients can throw out a lot of protein, and in these patients we'll have to stop the D-penicillamine and switch to Trientine. So that's an important thing to monitor, at least in the first year after diagnosis. Do monitor 24-hour urine protein, and this is often forgotten. So along with copper, measure the protein also, at least in the first year in patients who are on D-penicillin.